Hi, good morning, everyone, and welcome to Breakfast at UMHealth in conjunction with World Kidney Day. I'm Soo Ying from Renal Unit, Department of Medicine. It's a pleasure for me to chair this session. World Kidney Day is a global initiative to raise awareness about kidney health and the increasing burden of kidney disease worldwide. For today's sessions, we'll be discussing saving the planet with dialysis. While dialysis and kidney replacement therapies are life-saving, they also consume significant healthcare resources. This provides an important opportunity for us to reflect on how kidney care can be delivered in a more sustainable and environmental responsible way. Today, we are honored to have three speakers who will share their perspective on hemodialysis, peritoneal dialysis, and kidney transplantations. Without further delay, let us begin with our first speaker. It is my pleasure to introduce our first speaker, Dr. Chye, who will be speaking on hemodialysis. Dr. Chye is a consultant interventional nephrologist in Renal Unit, Faculty of Medicine, University of Malaya, with advanced training in interventional nephrology in Singapore and Japan. He will be sharing insight on hemodialysis and discussing on how we can move forward more sustainable dialysis practices while maintaining optimal patient care. Without further delay, I would like to invite Dr. Gan to deliver the first talk. Dr. Gan, the floor is yours.
Thank you very much, Ms. Chairperson, Dr. Yew. Thanks for your kind introduction and thanks for the unit to invite me to give this talk. I shall share my slide. Okay, I'm tasked to actually talk about a green initiative in hemodialysis, saving the planets with the dialysis. And World Kidney Days 2026 started this year with a theme of kidney health for all, caring for people and protecting the planet as well. So when we are protecting the human, we need to protect the planet. And my lecture content has got this introduction, key environmental impacts of the hemodialysis, green initiative in hemodialysis, challenges to implement the green dialysis, and conclusions. So imagine if you are here, as green as this, you can feel fresh and a lot of oxygen. So make it green in anything that you do. Hemodialysis is a life-saving treatment for patients with end-stage kidney disease. However, it is also a resource-intensive medical treatment with significant environmental impact. Dialysis procedures require large volumes of water, high energy consumption, and generate considerable medical waste, particularly single-use plastics. Each hemodialysis session may produce up to 2 kg of potentially contaminated waste, along with additional recyclable materials such as plastics and packaging. Healthcare contributes approximately 4 to 5% of global carbon emission, and kidney care represents a disproportionately high environmental burden due to frequent treatments and high resource requirements. As awareness of the climate changes increases, the concept of green nephrology or green dialysis has emerged, aiming to reduce the environmental footprint of dialysis service while maintaining high quality patient care. And I will talk the key environmental impacts of hemodialysis. Major environmental changes in dialysis include high water consumption, as mentioned earlier on. Hemodialysis requires large quantity of RO for dialysis productions, and reverse osmosis system may discard up to 60% of the treated water, contributing to significant water wastage. Example, usually we set the water run at around 500 mils per minute. Just imagine one patient, 500 mils per minute for 4 hours. One patient, one session itself is already 120 liters per treatment, which is a lot. And apart from that, energy consumption, dialysis unit require electricity for machine, water treatment system, lighting, climate control. In Malaysia, we don't need climate control, at least an aircon. And these energies demands contribute to the carbon footprint of dialysis care. You can see from there the light setting, the machines itself, and also the RO system that requires energy to run the units. Medical waste generation. Single-use consumables such as dialyzers, tubings, and dialysis bags produce large amounts of plastic waste, much of which cannot be recycled due to contamination risk. Such as the dialyzers, you can see from this picture. Dialysis tubing, all single-use. The A and B bottle, which is a bicarb and an acid bottle to mix the composition of the dialysate, and of course, some water flushing, which also contained by the plastic. Not forget about your dustbin and your biohazard bags as well. And carbon emissions from transportation as well, indirectly. So frequent travel by patients and healthcare staff to dialysis centers also contribute indirect to environmental footprint. The green initiative in hemodialysis that is fixed, or the initiative that's actually in the world that we are doing now, is for water saving interventions. Some actually use the rejected RO system for cleaning, sanitation, horticulture, and aquaponics. Why I highlighted it? Because it's done locally in Malaysia. Optimizing dialysate flow rates, water recycling system in dialysis units, and these strategies can significantly reduce water wastage and operational costs by diverting the use or contaminated water for planting. The water saving intervention that I told you earlier on about the aquaponics and horticulture started by Dr. Chung, my best friend from Sungai Petani, and it was published in a high impact journal regarding his techniques. So what he used is that rejected water was used to actually rear a fish and also plant the hydroponic plants. And whatever solutes that was rejected contains high urea and creatine, which is a very good source of budget for all the plants and the fish as well. We can see these fish are harvested, so-called rare, how to say, I won't say it's cultured, but it is rare. And you can see they can actually cook it for food, and probably you can recycle back for the hemodialysis patient, because hemodialysis patient tends to have sort of like a lack of protein due to the dialysis. And this another fish, I not quite sure what fish is that, ikan patin as written there. And you can see the quality of the fish is quite good with the water quality. And they cook it and they eat, and also they steam and fry it. So that's one of the initiatives started in Malaysia and it's got attention worldwide as well. And another carbon footprint reduction will be energy reduction approaches by installation of energy efficient dialysis machine, LED lighting system in dialysis units, solar energy integration, automated dialysis flow control, and energy efficient technologies reduce the greenhouse gas emissions and improve sustainability in the dialysis facilities. And waste reduction and recycling, another component, segregation of the contaminated and non-contaminated waste, recycling of non-infectious plastic and the packaging, reduction of unnecessary consumables, encouraging manufacturers to develop recyclable dialysis materials, and proper waste management that can substantially reduce the environmental pollution. And sustainable dialysis practice, this is not about the consumable, but this is practice. Probably rather than 3 times per week dialysis, some patient with a urine output, we can do the 2 times dialysis as long as patient safety is not jeopardized. So that will reduce the water usage and the electrical usage, meaning that the patient only requires 2 times dialysis per week. Optimize the dialysis preparations, meaning that probably you can reduce the QD or the flow of the water a little bit as long as patient KTOV or cleanliness of the blood is clean enough. Delaying dialysis nation when clinically appropriate. Of course, we don't delay until the patient breathless and jeopardize the safety. We try to delay as long as patient don't have symptoms, no acidosis, no hyperkalemia, and not fluid overload. And we don't only see that GFR of 6, then we just automatically directly dialyze the patient unless it's clinically indicated. Promoting home dialysis modality, which lesser water consumption indirectly, and also lesser sort of like bicarb bottles or acid bottles, because it's a home dialysis system is kind of a pre-packaged, which require lesser plastic usage. Incremental dialysis has been shown to significantly reduce the water usage and carbon emission. And another method is the carbon footprint from the transportation. Digital and telehealth solutions will be one of it. Telemedicine and virtual consultation reduce the patient travel to dialysis center, lowering transportation related emissions as well. And of course, home dialysis will reduce this carbon footprint as well. And sustainability of dialysis facilities design. So maybe the environmental friendly building materials that we can think of before we build the units of the dialysis unit, efficient heating and ventilation or cooling systems, like probably using inverter air cons rather than using a traditional air cons that consume more electric, renewable energy integration like solar panel, so on and so forth. And these infrastructures improve can help to reduce long-term environmental impact. So what is the challenges while implementing the green dialysis? It is nothing such as this river so serene and you sit there, you'll be very smooth. There are challenges, especially despite the growing awareness, implementation remains limited. A few studies indicated that many dialysis centers still lack of formal sustainability strategies, and only a minority have dedicated environment teams to oversee the green initiatives. Barriers include initial cost of green technologies, like solar panels is quite costly, limited awareness among healthcare professionals. That's why we have this talk today. Regulatory constraints, lack of standardized sustainability metrics for the time being. And I think I end my lecture. And conclusion is that green initiative in hemodialysis represent an important steps towards environmentally sustainable healthcare. Strategies such as water conservation, energy efficient, waste reduction, and sustainable clinical practice can significantly reduce the ecological impact of the dialysis care while maintaining patient safety and treatment quality. As the global burdens of chronic kidney disease continues to rise, integration of sustainability into the dialysis practice will be essential for the future of nephrology. With that, thank you very much. And this is my social media. You can go and Google or LinkedIn. I wish next time Blue Plumber can become a Green Plumber next time. Very much intervention at the moment. I'm so sorry to say that there are very much limitation to make it green because we use quite a lot of consumables. So maybe that will be our future challenges to try initiative green intervention nephrologies in future. With that, thank you very much.
Thank you, Dr. Gan, for the informative presentations and for highlighting the important considerations regarding hemodialysis and environmental sustainability. Next, we move on to our second speaker. Dr. Cheng will be discussing peritoneal dialysis. Dr. Cheng Feng is a consultant nephrologist in the Renal Unit, Department of Medicine, University Malaya Medical Center, who completed his fellowship training in peritoneal dialysis at the Chinese University of Hong Kong. Peritoneal dialysis is an important modality of kidney replacement therapy, offering the advantages of home-based treatment and potentially lower environmental impact. Let us now invite Dr. Cheng to share his insights. Dr. Cheng, please.
Right. Thank you very much. Thank you, Soo Ying, for the kind introduction. And good morning, everyone. So I'm Feng. I'm one of the nephrologists here in PPUM. Right, so just now we had heard an excellent overview from Dr. Gan about hemodialysis, which is a type of dialysis that maybe most of us are more familiar with, the kinds when patients usually need to travel to a hemodialysis center 3 times per week. So what I'm going to talk about next is actually a different way of delivering dialysis, which brings treatment closer to the patient at the comfort of their own home. And this method of dialysis is called peritoneal dialysis. But I also want to explore something that we don't always talk about, which is how peritoneal dialysis may affect the environment. Because when we think about healthcare, we often focus on saving lives, which is our priority, but we must also think about how we can deliver care responsibly and sustainably. And we talk about home-based dialysis. At least in Malaysia, I think we are referring mainly to peritoneal dialysis because home hemodialysis is few and far between. So this is a modality where patients can perform dialysis in their home environment rather than traveling to a dialysis centers. And for some patients, that's a huge difference in their daily lives. So imagine you have to go to a hemodialysis center 3 times a week, every week for many years. Now compare that to the comfort of your own bedroom. And this is what home dialysis therapies can offer: more independence, flexibility, and more time with your loved ones. So Instead of structuring your life around visits to the hemodialysis center or hospitals, treatment can now be integrated into daily life instead. Beyond quality of life, the other question that we should ask as well is, how does it change the environmental impact of healthcare? Let's start with something simple, water. So you have heard from Dr. Gan's slides just now, dialysis requires a significant amount of water. And in hemodialysis center, large volumes of water are purified and used to generate the dialysis fluid. So let me ask you a quick question. So imagine you're at home, you turn on your kitchen tap, and you let it run continuously for many hours. So how would you react at the end of the day or the month when you see your water bill? Probably not very happy, right? So now in the case of the hemodialysis centers, you multiply that by many patients, many days, and many years. So the question becomes, how can we deliver life-saving dialysis while also being mindful of water use? And this is what home-based dialysis systems may offer. We have the opportunity to rethink how we can redesign treatment systems, potentially making them more efficient and more sustainable. So then you must be thinking, if home dialysis, like in that sense, must then be better for environment since it saves so much water. But the reality is actually far more complicated than this. Healthcare, just like many other industries, has a carbon footprint. We may have reduced the carbon footprint of traveling to the HD centers, but every piece of medical equipment we use has a journey itself. It has to be manufactured, packaged, transported, and eventually disposed of. So even if treatment happens at home, the environmental impact doesn't just disappear. We have simply moved it where it happens. When we move healthcare delivery from hospital to home, we don't erase the environmental footprint. We moved it. Some of the emissions may decrease in the hospitals, but they may increase somewhere else. So if we truly want greener healthcare, we cannot only look at one part of the system. We need to look at the entire journey of care, from factory to hospital, to patient, to waste management. And only by looking at the whole system, we can find meaningful solutions. Another aspect that is often overlooked is the amount of material used in modern healthcare. And dialysis treatments rely heavily on single-use medical supplies, just like what Dr. Gan explained just now. And there is a very good reason for that. Single-use items actually help prevent infections and keep patients safe. But it means that there will be a lot of plastic involved. And when you look at the numbers, many are often shocked. And even as doctors like us, although we know that the numbers would be on the higher end, some of us are still surprised when we see the actual figures. But we need to remember that this waste exists because patient safety is being prioritized. And hence the challenge is not to eliminate these materials, but on how we can redesign our system so that on one hand, we can maintain safety, but on the other hand, we also want to reduce waste and environmental impact. And when we think about all these medical supplies, we only focus on what happens when it's being discarded. But interestingly, many studies have suggested that a large portion of this carbon footprint occurs earlier in the journey. So if we want greener healthcare, we need to think about the whole supply chain and not just the waste bin. And one such approach of reducing waste is something we call incremental dialysis. And just like hemodialysis, there is also incremental peritoneal dialysis. And our healthcare has traditionally been designed around standard packages, standard treatment, package A, B, and C. But not every patient requires exactly the same package. And by tailoring treatment more precisely, we will be able to reduce unnecessary materials while maintaining high quality care. And sometimes less is more. Less waste, less unnecessary resource use, but still delivering the same medical benefit for the patient. And this is an area where doctors, patients, and healthcare systems can work together to be a little bit more thoughtful about how we deliver care. And many people assume that these medical plastics are biohazardous and cannot be recycled. But the fact is, reality is probably a little bit more nuanced than some of the plastics used in dialysis, such as certain types of medical grade PVC, are technically recyclable. And so the material itself is not always the problem. The bigger challenge for us is probably logistics. How can we safely collect these materials? How do we ensure that they are properly cleaned and separated? And how can we build systems that allow recycling to happen efficiently? And recycling will only work if there is a system in place to collect, to sort, and to process these materials. And without that infrastructure, even if you have the best recyclable materials, it may still end up as waste. So to solve this problem, it requires collaboration between healthcare providers, manufacturers, waste management companies, and importantly, policymakers. And one of the most exciting developments in modern healthcare is the use of digital technology. All our patients, dialysis patients, would require regular follow-up visits. Traditionally, this means traveling to hospitals for routine reviews. And we know how much time and carbon footprint that will incur. But nowadays, increasingly, we can use telemedicine and remote monitoring whenever applicable. Patients can check in with their healthcare team from home. Doctors can review data remotely. And some consultations can actually take place virtually. So it saves time for the patient, it reduces travel, reduces the jam on the road nowadays, saves our time in terms of fighting for parking, and more importantly, it reduces the environmental impact associated with repeated hospital visits. And looking even further into the future, researchers are exploring ideas such as point of care manufacturing. This means that producing certain medical fluid or supplies closer to where they are actually needed and used. And if some of these products could be generated locally, perhaps even within the healthcare facilities or at home, it could significantly reduce transportation emissions. And these technologies are still evolving, but they highlight something important to us. Innovation in healthcare isn't only about better medicine, it's also about better systems. Systems that deliver the same life-saving treatment, but with less environmental impact. And I often like to remind my patients of something very simple. The most energy efficient filter is actually the human kidney itself. Our kidneys work 24 hours a day, filtering blood continuously, and they do this without consuming any electricity, without consuming excess water, or generating any carbon footprint. So one of the most important messages of World Kidney Day is actually prevention. Simple things like controlling your blood pressure, managing diabetes, staying physically active, and having regular health screening can protect our kidneys for many years to come. And because the best dialysis machine is the one that you never need to use. And addressing the environmental impact of healthcare cannot be done by a group alone. It takes a village to change this. We need patients to play a role, doctors, nurses, and hospital administrators, manufacturers, waste management systems, and policymakers also need to play their role. And each part of the system contributes a small piece to the solution. And when those pieces come together, meaningful change becomes possible. And just as caring for patient requires a multidisciplinary teamwork, caring for the planet requires teamwork as well. So to summarize what I've discussed today, home-based dialysis can offer many benefits, including greater independence and flexibility for patients. But if we want to be truly sustainable, we need to look at the entire journey of care, from water use to manufacturing, to transport, to waste management, and to digital healthcare. At the same time, we should always remember that the most elegant solution of all is the human kidney itself. And that brings us naturally to the next topic by Dr. Uy, who will be discussing about kidney transplantation, for which many patients offer the closest thing to restoring the natural kidney function. And so with that, I thank you all for your attention and look forward to the rest of this session.
Thank you, Dr. Cheng, for the excellent presentations. Our final speaker today is Dr. Uy, who will be speaking on kidney transplantations. Dr. Uy Sok Hoon is a nephrologist in our renal unit, Department of Medicine, University Malaya Medical Center, with transplant nephrology training from McMaster University in Canada. In addition to improving patient survival and quality of life, transplantation may also represent a more sustainable long-term solutions for kidney replacement therapy. Let us now invite Dr. Uy to deliver the final talk. Dr. Uy, the floor is yours.
Thank you, Dr. Yew, for the kind introductions. My name is Shok. I'm one of the nephrologists in the nephrology team. So today I will be speaking on the green nephrology in the kidney transplantation in conjunction with the World Kidney Day with the themes of the caring for the people, protecting the planet. So as we know that the kidney transplantations is the best form of the kidney replacement therapy in the patients with the kidney failure. So that's why I think that it's worthwhile for us to talk about the green nephrology about the kidney transplantations. All right, so okay, seems to be working. Okay, so based according to the 2025 State of the Climax reports, so it warns that the planet right now is in the crisis of the climate threshold. So basically the consequences of the humans alterations of the climate have not becomes the future threat, but this is the current problems that we are facing now. So there is the emergency stem from this the field foresight and also for the political inaction and also the unsustainable ecosystem that contributes to the climate chaos. So based on the World Meteorological Organizations, they reported that in the 2024, it was the hottest temperature that was recorded of the year. So as you can see, that's the rising of the temperature that is basically due to the greenhouse gases emissions. And on the table there on the right, as you can see that every corner of the world basically have the feelings of the heats of the floods and also the fire. Therefore, as we know that in the healthcare system, we contributed around like 4 to 5% of the greenhouse gases emissions, especially in the kidney care, particularly dialysis, where it is a resources intensive in the healthcare system. So what is the clinical implications of the climate that related to the health risk? There is a direct clinical implications of the climate on the kidney transplant recipient. First is mainly because of the kidney transplant recipient, they are on the chronic immunosuppression. Therefore, it makes the patients vulnerable to the infection given the immunosuppressed state. So the second would be the environment change, such as the flooding, will promote the spread of the vector-borne and also the water-borne pathogens such as the leptospira and also the dengue fever. The air pollution, largely driven by the fossil fuel, is also the major contributors for the cardiovascular disease. This will be the leading cause of the morbidity and the mortality in the kidney transplant recipient. The extreme weather, such as the storm, the flood, will affect the healthcare, the delivery, particularly affecting the patients attending the clinics for the follow-up and also disrupt the medications delivery. And for the organs, the preservations will be affected, especially in the disease donor kidney transplantation. And last will be the heat wave that causes by the dehydrations. It will be further amplified by the risk of the allograft injury, especially by and large, all the kidney transplant recipient, they are on the calcineurin inhibitor, as we understand the mechanisms of the drug, where it has the vasoconstriction. Therefore, it will amplify the patients to have the risk of the nephrotoxicity. So as we know that there is the two forms of the renal replacement therapy, that's including the dialysis and also the transplantations. So based on the well-known for the past few decades, the data have shown that the transplantation itself tend to have the promote the patient's a better survival and also improve the patient's health-related quality of life. At the same time, it has a much more lesser financial burdens on the healthcare system. How about the environmental burden? So whenever we are considering for the patient's kidney replacement therapy in the patients who are having the kidney failure, we have to consider about the environmental footprint. As we know that the dialysis itself, has the worst environmental footprint, mainly because of the high energy use, the water use, and also the medical consumable use. The transplantations itself, it able to provide a patient a better options, the clinical option, and also more environmental sustainability towards the environment. Why do I say so? So this has been shown in a study that was carried out in the Vancouver. They basically using the comparative life cycle assessment as a part of the performance metric to look into the environmental impact of the kidney replacement therapy. So what they have found is that the hemodialysis itself has the worst ever of the CO2 emissions, and also they do have the worst ever of the ozone depletion and also the air pollution compared to the patients who are on the kidney who going through for the kidney transplantation. So a similar analysis also was done to look into the total greenhouse gases emission in the different modes of the dialysis. So what I mean by the in-center hemodialysis is the patients who going for the hemodialysis to the center 3 times a week, and each sessions will spend up to like 4 hours in the center. So with that modes of the dialysis, the patients will produce up to 32.9 of the CO2 emissions. Don't forget, the patients who are on this mode on the dialysis, they are required up to the 156 sessions of the hemodialysis. That makes up a total of like more than 5,000 of the GHG emissions per patient. How about a patients who doing the peritoneal dialysis? So for example, in the patients who are on the CAPD, they only produce up to like 4.5 of the GHG emission, which is much more significant lesser compared to the inpatients hemodialysis. Because of the CAPD most required patients to doing a daily CAPD. So they will round up to be approximately produce up to the 1.6 thousands of GHG emissions per patient. So in this analysis, they also look into the kidney transplantation. So for the kidney transplantation, living donor itself has the lowest of the GHG emissions compared to the patients who undergo a deceased donor kidney transplantations. They produce up to like 2,000 of the GHG emissions, largely contributed by the transportation. So the transportations mainly was coming for the pre-transplantations, the workout, and while the patients on the dialysis itself, the patients have to come for like annual or the 6-monthly review to make sure that they are fit enough to be in the listing, and at last also involve the deceased organ transportations to the hospital. That's why it makes the total GHG emissions much more higher in the deceased donor kidney transplantation. So subsequently is the graph that basically showing that the GHG emissions per transplantation or the per 1 year of the dialysis. So as you can see here, the dialysis have the worst ever environmental footprint. A recent analysis have shows that a kidney transplantation able to reduce the CO2 emissions up to 95 to 99% of the CO2 emissions compared to the patients who are on the maintenance dialysis. So therefore, if expanding the kidney transplantations pool would be able to provide a patient a better outcome, and also would be less environmental impacts to the healthcare system. Although we understand about the awareness on this the environmental sustainability, but the change is often so. So there is a few like barrier-wise wise the implementations is much more slower than what we can ever think of. So, for example, would be the lack of the awareness from the healthcare worker, the challenges from the institute, the cost that incur in the decarbonization journey, and also the repetitions or the unnecessary testing during the clinical visit. So what I think is the main barrier in terms of the implementations would be the gaps that between the ambitions and also the actions. So recognizing the problems would be the first step, but to make a meaningful changes would require the implementations of the practical changes. So this article, it was just published in the last week with the title of No More Waiting, and they have suggestions of the 10 tips to turn the kidney transplantation green. Let's look into what are the 10 tips that suggested in this article. So the first one, they suggest the consider environmental footprint of the transplantation assessment and avoid the unnecessary tests and reduce the associated travel. So with patient, the carbon footprints of the pre-operations evaluations of the potential living donor will produce up to the 114 carbon dioxide emission. This is almost equivalent to like burning up to 127 pounds of the charcoal, the CO2 emissions. So in the North America, what do they did is that they have a one-day donor kidney assessment. So basically, they're asking the donor to come to the hospital on that day in the mornings. They will do all the routine blood investigation, including the immunological testing. At the same time, they will proceed with the cardiac testing and also the kidney structure and also the functional testing, including like the MAC3 and also the CT scan. And on the similar day itself, they do have a nephrologist and also the urologist consultation to assess them whether are they feasible to be a kidney donor. By doing that, they're able to reduce the environmental impact. Second will be to reduce the environmental footprints of the organ retrieval and also consider the donor transportations and the evaluations on the use of the drone. So organ retrieval has the environmental impacts related to the energy consumptions, the surgical equipment, the waste generations, and the travel. I think this is probably more applicable to certain programs like the kidney pair exchange and also the interprovincial organ sharing in the living cases or the deceased kidney transplantations, although both of the programs are not available in Malaysia. So by and large, because of the program itself, both the donor and the recipient, they will be from the different hospital, different state. That's why with the transportation itself, it will cause a lot of the CO2 emissions. The third one will be promoting the preemptive kidney transplantations and reduce the environmental footprint associated with the dialysis. So each of the successful kidney transplantation will be able to save up to like 2 to 3 tons of the CO2 emissions per year. So I think this is applicable in our current clinical setting, especially whenever we are seeing the patient in the CKD clinic. We can consider to introduce the patients for the kidney replacement therapy counseling whenever the patients have an eGFR of like less than 20 or they have a higher scoring for the KFRE. So with the much more early implementations of the counseling and the decisions, if the patients would like to move on with the transplantations, we can initiate the workout much more earlier. And probably with that, we can avoid the dialysis before the patients require for that. The fourth ones will be reduce the waste during the transplantation surgery and consider the tray optimizations and promotes the virtual cross-match. So as we know that operations theatre is most resources intensive where it has a very high the electrical, the water usage and also produce up to like 50 to 70% of the waste for the hospital. So with the smart energy approaches such as the solar panel of the heating and the ventilations could able reduce the carbon footprint and also refine the surgical tray by removing the lesser use of the equipment from the tray would reduce the frequency of the sterilization and also the washing. At last, the virtual cross-match is not available in Malaysia, but in the overseas, it has been shown that it able to reduce the ischemic time and also its labor saving. The fifth one will be consider the environmental footprints of the anesthesia. As we know that for volatile anesthetic medications have the global warming potential. So by replacing it with the total IV anesthesia would be the preferred one, but also have to take into the account for the IV anesthesia that will contribute to the plastic weightage. Moving on with the next one is think about the carbon footprints of the professional development and the scientific meeting. You won't be surprised that the participant who attending the European Renal Association's 2023 Congress, where they found out just purely by the air travel itself, it produced up to the 5,808 tons of the CO2 emissions. And we have to acknowledge that other than the air travel, the accommodations, the local transportations, the waste catering, and also the material does contribute to all these the GHG emissions. So I think what's the best would be the hybrids meeting or having the virtual meetings where it able to be a bit more environmental friendly. At the same time, we able to maintain the academics collaboration. The next one is to reduce the unnecessary and also the duplications of the laboratory testing during the transplantations aftercare. So this is very applicable to our current clinical setting, especially we know that a close monitoring of the kidney allograft is very important, especially during the first few months after the kidney transplantation. So wisely consider on like when and how frequent you like to monitor the tacrolimus level by understanding the pharmacokinetic and also the pharmacodynamics of the medication and also the other post-transplant related viruses. The other things that in the future, what we can consider is the collaborations with the private, the laboratory, so that the patients will be able to reduce the transportations and doing the testing much more closer to the home. Some things that's getting attention in this few years is like point of care testing, but we have to bear in mind the sensitivity and the specificity before the implementations in our clinical setting. Number 8 will be offer the virtual appointments for the routine follow-ups. So virtual consultations can be safe for the stable post-transplant aftercare, especially patients like who are like 2 years, 3 years after the transplantation. It will be very convenient for the patients who live from the far and who have a very tight schedule. The last two will be considered the carbon footprints of the transplant research. I think this is very limited, and in the current our local setting, we do not have the study on the current footprint. I think that worthwhile for us to explore and to look into how much the GHG emissions from our clinical setting. And last will be review all the clinical pathway and also the transplantations as a showcase for the excellent environmental friendly care. So one of it will be try to avoid the unnecessary testing, especially patients who have a low cardiovascular risk, young patients who are non-smoker, no family history of the heart problem. We can try to avoid like ECG, this one, the exercise stress test, or doing the invasive like coronary angiograms for them. So what can the transplant programs do for today? All right, so as we know that the kidney transplantations, they are much more environmental friendly. So I think that's what we can do right now. And now, starting from today, there are the few things that we can implement it. So for example, would be the encourage the patients to have the preventive kidney transplantation. And the second thing is we can consider to use the non-invasive civilian and the diagnostic testing to monitor for the kidney allograft rejections. Try to avoid the duplications of the blood testing during the clinic follow-up, and also to consider about the telemedicine or the virtual follow-up for the patients. So in the end, I would like to end basically Professor Mike Bernally. He is the expert leadings for the climax for the carbon footprint and also the sustainability expert. So he come up with the jokes that the less green choice a human beings can make is to have a child. So I think that this is quite sensible. It's mainly because of we as a human being living every day, we produce a lot of the CO2 emissions. And also with the advance of the technology, we tend to have a longer lifespan and growing in the populations. Therefore, I think that's having more child and increasing the lifespan and the growing populations would produce more the CO2 emissions. With that, thank you.
Thank you, Dr. Uy, for that insightful presentations. We have now come to the Q&A sessions. If you have any questions for our speakers, please feel free to type them in the chat box, and I will direct them to the respective speakers. I think we have questions from Prof. Chung for Dr. Gan. The question is, can the wastewater generated be contaminated with medications from patients? And I think seems like everyone is concerned about whether the wastewater can still be used to rear fish or vegetables. So, and how are we going to educate the public and address this misconception?
Right. Thank you very much, Prof. Chan and Dr. Anas, for the great question. Very valid. Well, to know the system of the discardation of the water is actually doesn't mix with the blood. So practically, if you remember, the dialyzer is side by side through a semi-permeable membrane, where some of dialysable substance will be dialysed. So as for Prof. Chan's question, whether the water will contaminated with medication, yes, possible, because there are some medication actually be able to dialyze out. So the fish will get hypotensive, but not the vegetables, I suppose, for the antihypertensive. But I suppose we are not drinking the water directly, and with time, I suppose the medication molecules will degrade with time, and by the time we harvest the plants and the fish, the effect is probably negligible, and the amount will be quite negligible in a large volume of water discarded into the plant. Yeah. So I suppose that's not the major concern. And as for Dr. Anna's concern, I mean, he has point that a lot of people thinking water is toxic and dirty, but how to educate them? Very easy. The water that is discarded will go to the centralized filtering system in the municipality and revert back to drinking. So that is still the same thing. Of course, the most concerned part will be if a virus that is actually contaminating, like HIV, hepatitis B and C. That is the main concern. Of course, we have got the blood leak dialysis detector. So when it detects, it will actually stop the machine directly, and there's no exchange of water. And probably we need to sort of like if planning to do this system, we need to give a blueprint on how to manage this blood leak, sort of like membrane leak and leaking the bloods into the system to discard it and not to use the water. Something sort of like such system. But all in all, as a virus goes out to the environment, it will die unless it's contaminated with blood, and that's the main concern. Even that also we still discarded, and it also goes back to the system, chlorinize and go back to the municipality. Well, it still comes back to our water tap. So well, if you're worried about the water tap you're drinking, then you may not know that the water actually recycled before from the dialysis center. That's my take. Yeah. All right. Thank you.
Thank you, Dr. Gan, for the clear explanations. We have another question from Prof. Chan. Has the total number of dialysis per total population increased in the country? I think maybe Dr. Cheng can comment on this.
Right. Okay. Thank you very much, Prof. Chan, for your question. So, to comment on the number of total dialysis per total population, when we look at the Malaysian Dialysis and Transplant Registry, at least the data up to 2004, for previous years on average, up to 2003, the incidence rates are actually increasing. But surprisingly, for 2024, the incidence rate, the new dialysis incident rate per million population has actually dropped slightly. And we have approximately 9,400 something new dialysis patients in 2024, and about 200 of them have been 200 successful transplants in 2024 as well. So yeah, to answer your question in a simpler way, for 2024, we have seen a slight drop in the total number of dialysis patients per total population.
So we have another question from Prof. Shereen, our head of Green at UMHealth for Sustainability in Healthcare. First, I would like to thank you, Prof. Shereen, for the very encouraging comment. I think the question is, What steps has the nephrology team in UMMC already taken to address the environmental sustainability? And what is the 5-year vision moving forward? Maybe we can start with Dr. Ooi from the transplant perspective.
Okay, so thank you for the question. So I think that for the kidney transplant perspective, as I covered just now in the lecture, so I feel like the ones that we can do would be promoting the patients to have the preemptive kidney transplantation, as we know that the dialysis itself is a resources intensive and it causes a lot of the CO2 emissions. So by promoting the patients to have a preemptive kidney transplantations whenever they are indicated. But I totally agree with the Dr. Cheng's whenever the patient's having a CKD itself, our effort should be paid in order to reduce the progressions on the CKD. I think that would be the first step. And otherwise, for the transplantations, I think the next things that we can look into would be form the one-day donor and the recipient assessment clinic. I think this is something that can be done in our local setting, but we need the collaborations with other departments, for example, the radiology department, the cardio, and also the urology and the anesthesia department. Because when I was training in the overseas, this is something that they did where they need all these the urologists, nephrologists, everyone come to the clinics and they assess the patients in that afternoon, and you have a limited time, for example, 15 minutes per person to assess the patient so that everyone can move on in that one day the donor assessment clinic. And the other things that I think worthwhile to look into will be the virtual consultation. So virtual consultations will be something that's applicable, I think, especially for the post-transplantations when they are very stable. So you can see them with a meeting, you're able to reduce the transportation and also the loads in the clinic's waiting list. I think that will be a worthwhile and something that could be implemented in these few years.
Thank you, Dr. Ooi. Perhaps Dr. Cheng could also comment on PD perspective.
All right. Okay. So just to add on, I think the for us nephrologists from the society level, we have already been hoping to come up with the guidelines, or at least clinical practice guidelines and policy on green nephrology, and hoping that it can be published soon enough. And in terms of PD, I think one of the things that starting from top down, the Minister of Health has said that we are introducing a PD first policy. Hopefully, this can be implemented nationwide. Can see the additional benefits of PD. And in terms of in a local setting, in the hospital, I think our vendors for peritoneal dialysis have been doing a good job in terms of supporting these green efforts. So one of the vendors actually will have a Jom Recycle program. So what they do is actually they collect the empty dialysis fluid bags and tubings directly from the patient, and then they send them to be recycled. A different vendor has actually went more green in their operation side, so they have produced their own proprietary material, which is not PVC. So what they told me was that this material it can be recycled, or even if incinerated, it actually comes down to carbon dioxide and water. And of course, we also have our remote monitoring in certain patients with their peritoneal dialysis machines, and also incremental peritoneal dialysis. So I guess my vision of what can be achieved is if we can get peritoneal dialysis first policy to be implemented nationwide, that would be a good first step to go.
Thank you, Dr. Cheng, for sharing the visions for the PD point of view. For Dr. Gan, anything you want to add on for the hemodialysis part?
Right. For hemodialysis part, actually we are doing incremental in our unit. Incremental dialysis meaning that you don't dialyze 3 times per day or something like that, 3 times per week, and that will reduce the carbon footprint. Secondly, we also, if you remember the bottle A, bottle B mixture, we changed the ratio to a ratio that requires less water usage, and hence that also reduce the carbon footprint. As for interventional nephrologist perspective, The avoidance of the dialysis catheter, which is a plastic, is one of the way to reduce the carbon footprint. How to reduce it? Of course, one is to take care of access. So the initiative that we are having now is access dysfunction. We have a team of nurses that can actually do ultrasound assessment together with the doctors and also alert us. And we do ultrasound guided cannulation that will avoid unnecessary catheter insertion. So that is one of our efforts in the green nephrology efforts in these 5 years. And of course, hoping that vendors in future can produce those intervention balloons or catheters, this and that, which is a biodegradable, that can be allows to reduce the footprint. And apart from that, I suppose we need to increase adoption of home dialysis, which is not so popular in Malaysia at the moment. That will also reduce very much of the carbon footprint as well and the electricity. With that, I thanks for the question that has been raised.
Thank you, Dr. Gan. Thank you for sharing visions for our renal units. Hopefully, all of us play a small roles in reaching the visions in the 5 years' time. And thank you to all our speakers for the excellence and enlightening presentations. Today's sessions has highlighted not only advances in the kidney replacement therapy, but also the importance of integrating environmental sustainability into healthcare practice. I would like to thank all the participants for joining us and for your active engagement. With that, thank you for everyone.